MMT, knee extension, quadriceps femoris. Assist the patient to the short sitting position with their feet supported by a stool or on the floor. The trunk may be supported by placing the hands flat or fisted at the sides or by leaning the trunk slightly. Do not allow the patient to lock the knee. Instead, make sure there is a slight amount of knee flexion. Standing next to the leg being tested, passively move the patient's knee through extension. You are not assessing the infield. You are determining how much range the patient is able to move in this direction so that you can appropriately assign a grade. In patient-appropriate language, ask the patient to extend the knee as you observe for any substitutions. Stabilize the patient at the distal femur just proximal to the knee. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include any extraneous movement of the pelvis. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the distal femur by placing your hand underneath the knee. This hand will offer counterpressure in an anterior direction. Place your other hand on the anterior surface of the leg just proximal to the ankle. This hand will apply the resistance in a downward direction toward the floor. Apply the force for a 5-second count. Grade 5, normal. The knee extended to the available range of motion and the patient was able to hold the end position against maximal resistance with no break in the position. Keep in mind that it will be extremely difficult to break normal knee extension. Grade 4, good. Knee extended to the available range of motion and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in knee flexion, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into the side-lying position with the test leg on top. The lowermost leg can be flexed for stability. The limb to be tested is positioned in 90 degrees of flexion. Make sure the hip is in full extension. The gravity-eliminated position of the therapist is to stand behind the patient at knee level. With one arm, cradle the test leg around the thigh, with the hand supporting the underside of the knee. The other hand holds the leg just above the malleolus. Make sure the leg you are supporting is in 90 degrees of flexion and that the hip is in full extension. Ask the patient to extend the knee. The therapist supports the knee and provides neither resistance nor assistance through the patient's movement. Be alert to the common substitution in this position of internally rotating the leg to allow gravity to allow the knee to fall into full extension. Grade 2, poor. The patient completes full range of motion in the side-lying position. If this condition is not met, then you must reposition the patient to test for a grade 1 or 0. Position the patient in the supine position. The therapist's position for grade 1 and grade 0 is to stand next to the leg being tested at knee level. Use one hand to palpate the quadriceps tendon just above the patella. Gently hold the tendon between the thumb and the fingers. You may also palpate the patellar tendon with 2 to 4 fingers just below the knee. Ask the patient to attempt to contract the quadriceps muscle. Grade 1, trace. There is partial range of motion or you're able to palpate a contraction of the quadriceps through the patellar tendon. Grade 0, no palpable contraction.